Bob Harper is a trainer for The Biggest Loser. He is very fit, and he just dropped in a gym, and he almost died. I saw him on the Dr. Oz show, and he was talking about this lipoprotein A condition that he has that caused his heart attack. And I'm like, oh God, I really have to get this done.
Lipoprotein A is a cholesterol, just like LDL cholesterol, which is the bad cholesterol, and it's similar to LDL cholesterol, except it has a protein attached to it, which produces plaque and produces blood clots. So two bad things that can occur that causes heart attacks and strokes. 1 in 5 or 20% of Americans have an elevated Lp(a), and they don't know it. Most people don't know it. So we'd like to increase the awareness about this. So even though there's no specific treatment for Lp(a) right now, there are a lot of things that we can do to help them decrease the risk. One thing we can do is ask that patient to take a baby aspirin a day to prevent those blood clots. And then the other thing is to lower their bad cholesterol, the LDL cholesterol, that can prevent future events.
I found out about the lipoprotein A test through my oldest brother, who had this test done on his own daughter when she was going in for surgery, and said that it was a hereditary blood typing that we should all be aware of if we have it or not.
So people with family history, either brother, mother, or father that had an early heart attack or stroke, you need to get checked out, not only for the usual things, but for inherited things like the lipoprotein A. The test for lipoprotein A or Lp(a) is not usually done on a routine basis, but if you ask for it and your doctor doesn't know anything about it, you can ask to be referred to a specialist for this problem.
I requested the test to be done on my insistence, and my doctor questioned my concern of why do I want to know that when there's really nothing you could do about it. And I found that quite frustrating, that I really had to push for the test to be done. But I'm glad that I did. The results came back that I had a high number, elevated number of lipoprotein A.
So Bridget just moved here from another city, and she came to the Rush Heart Center for Women because she found out that we do test for this and we are aware about this. So Bridget, tell me about your family history.
Dr. Volgman was very welcoming, concerned for me as a patient, as an individual, like I could have all day with her.
The next step was to find out if she already had disease, and she had no symptoms that would make me want to do more testing.
I feel like I am benefiting from being at Rush and an academic research hospital with Dr. Volgman, who is a doctor who's actually doing the research side. This is something that there's no cure for it yet, but I feel like if there's going to be one, I'm at the right place to be taken care of.
If you are a person who has an elevated lipoprotein A or Lp(a), don't panic, don't get anxious, do something. Either come to the Rush Heart Center for Women or the University Cardiologist if you're a man to get further instructions on how to lower your risk. Or if you're not in the Chicago area, Chicagoland area, look at LPA Foundation website and they can refer you or suggest some people who are experts at this.